My name is Jonathan Himmelfarb, and I want to welcome everybody to our 5th annual Ideas meeting here in Seattle. This should be a very exciting meeting, really touching on what's coming, what's innovative, and how can we change the outcomes for our patients that are living with kidney disease. Well, I'm going to just give a brief introduction, some personal thinking about our field, and more from a historical perspective. And I think the very first Ideas meeting, the very first introduction, we talked about Willem Kolff and we talked about Belding Scribner as really the iconic heroes in our field from the 1940s and the 1960s onward. I was thinking about why do we really think of them as heroes? And there are a number of reasons. They really were physicians, and they both wrote about this extensively, who were motivated and really haunted by what they couldn't do for their patients. And that's what drove them to wake up in the middle of the night and come up with ideas like the Scribner shunt, or in Kolff's case, to dialyze 15 people, all of whom died, but to keep going, to persevere until the 16th person that he dialyzed back in the 1940s actually survived. They were stubborn. They didn't take no for an answer. They kept going. They persisted because they were driven by the idea that they had to make something happen. And once they developed their really inspiring, innovative technologies, they didn't keep them to themselves, but they tried to disseminate them throughout the world. So the picture over here, let's see if I point right, the Kolff rotating drums. Kolff sent 4 drums to America as soon as he could after the war, to the Brigham, where the Brigham improved on the Kolff design and it became the Kolff Brigham kidney, to Mount Sinai, to Cleveland Clinic. And last year at Ideas meeting, we did an interview with Jack Cole, who worked with Belding Scribner throughout Scribner's career. He was the technician who actually made all the Scribner shunts. And the first ASIO meeting after they made the Scribner shunt, Belding Scribner brought Jack Cole. They took a room in the hotel. He brought all his apparatuses with him to mold glass, bend glass, etc. And he taught everybody, all the doctors in the room, he taught them all how to make Scribner shunts. So they didn't keep the technologies for themselves. They didn't publish their papers in Nature or Science or the New England Journal of Medicine. They didn't care about that. They published their papers in ASIO journals back then. What they cared about was getting their technologies to patients who needed something better than what they had. But there have been other heroes too. And, I never got to meet either Kolff or Scribner. I did get to meet George Schreiner, who was an amazing character at Georgetown, where he was the director of nephrology from the 1940s onward. He died in 2012 at the age of 90. Remarkably, he was the president of the ASN, the ISN, and the NKF at different points in his career. And he did every single kidney biopsy done at the NIH for 23 years. But he told the story of biopsying a tiger once at the Georgetown Zoo, and I heard him tell this story about being asked to do a kidney biopsy on a tiger, and he said to them, well, what kind of sedation? And they said, we're just going to live a little bit of sedation and a little bit of local anesthesia. And he said, if you want me to biopsy this tiger, the tiger better be under general anesthesia. So he was really a charismatic kind of character. I was very young. I think it was the first or second major talk I ever did that he moderated at a national meeting. And 2 days later, in the midst of hundreds of people walking by, he said, hello, Jonathan, facial recognition, name recognition, consummate politician. And what he really did was he was the politician who worked with Congress to get the ESRD through Congress in 1972 as an amendment to the Social Security Act, basically working with all the senators and everybody to get them to buy into this. So he almost single-handedly led to a fundamental change in access to dialysis care. But he couldn't do it alone. And Shep Glazer is a very interesting example of patient activation making a difference. So Shep Glazer was from New York, was on dialysis, and insisted on dialyzing himself in front of Congress. And he actually went to Schreiner, George Schreiner, and George Schreiner thought this was a terrible idea and said, we really shouldn't do this. And one of Schreiner's fellows, though, took Shep Glazer and dialyzed him in front of Congress. Supposedly, Shep Glazer went into a lethal arrhythmia, ventricular tachycardia, 5 minutes into the treatment, and the fellow stopped the treatment. And supposedly the congressman thought, well, if a 5-minute treatment is going to save everybody's life, then we should support this. So, this was an example, almost a precursor to the ACT UP movement and the HIV activists about 20 years later, of patients just saying, I'm going to break down every barrier. This is not right. Lives are being lost. But in the more modern era, somebody who I found to be an amazing person was Celeste Castillo Lee. And she's a much kinder, gentler, gracious version, if you will, of Shep Glazer, but equally persistent, was equally fearless in advocating for patients and advocating for change. She lived most of her life. She developed vasculitis as a teenager and lived 3/4 of her life with kidney failure, mostly on dialysis. And yet, with that, was chief of staff to Victor Zhao. Some of you may know him now as the president of the National Academy of Medicine, but at the time, he was the president and CEO of the Duke healthcare system. She was the vice president for health at the University of Michigan, a fearless patient advocate who founded the Kidney Health Initiative Patient and Family Partnership Council and influenced everybody who came into contact with her. She would come to these meetings. She would be incredibly articulate. And while we're all going out to dinner that night, she's flying home so she can get her dialysis treatment the next day. So she was such an amazing person that both the ASN and the NKF decided to honor her after she passed away by creating lectureships and patient engagement awards. Really a charismatic person who had a huge influence to catalyze change. Oh, it's not even showing that. That's because I've got to click, I guess. And we've talked a lot about Bill Peckham, and we'll hear more about Bill Peckham. He was a local person in this community, also with amazing agency as a patient and a great deal of impact on many, many people. And I would submit that the 3 winners to date of the Peckham Lectureship at this meeting are all also pioneers who've made a difference. They really are heroes to us as well. They're all patients who've had agency, and they work tirelessly to support others getting better treatments in the future. And our Peckham lecturer this year is a little bit different, Lily Cervantes, in that she's a physician. But she'll tell an amazing story of what she's accomplished to see to it that undocumented immigrants get access to dialysis, first in Colorado and then generally in the United States. Also an amazing advocate for patients. So we live in an era right now of change, and some of this was catalyzed by people like Celeste Castillo Lee through the Kidney Health Initiative. And we've got the Kidney X competition. So after years and years of stagnation, suddenly there's a spirit of change in the air for all of us, for innovation, to try to come up with different ways to treat people with advanced kidney disease. And it's not just an American phenomenon. It's a global phenomena. And there are increasingly various collaborations between the different entities around the world that are working to try to innovate in ways that will be patient-centered. So it's an exciting time, and this is from the Kidney Health Initiative roadmap, telling us some of the different approaches that can be taken to make dialysis better, to make it portable, to implant, come up with biohybrid devices and implantable devices, and regenerative medicine approaches. And I would add to this probably now xenotransplantation, and we'll hear about xenotransplantation during this meeting. So cell-based therapies are also being advanced over time. But I want to say that despite all the excitement and despite all the people that are working so hard to come up with new therapies, if you're a patient in 2022, it still hasn't changed very much. So the COVID epidemic exemplified that. Here in the United States, close to 500,000 of the most medically vulnerable people could not self-isolate. They had to go into a dialysis center 3 times a week, and the first time in over 50 years, there are less dialysis patients in the United States than there were before COVID, because the death rate went up so much during the COVID epidemic. So, we haven't come up with systems yet that really fundamentally change the options that most patients have. And that's true for environmental disasters. It's true right now in Ukraine when there's war in terms of access to care for dialysis patients. So we're not there yet. There's a lot of excitement. There's a lot of work that's being done. And I do think it will make a difference. But right now, if you're a patient, you don't have any new options to speak of that you didn't have before. So we need to keep that in mind. And the one thing that I would say that worries me is there is this thing sometimes known as the hope-hype cycle, where we have gone through a period of hope with all the people in this room and all the organizations that are dedicated to change. But if it takes too long, and it will take time, this is not going to happen overnight, there is always a risk that people will get disillusioned because you're still getting the same options if you're a patient that you had 5 years ago, despite all the work that's being done. But we have to see this through to get to the other side of this. So the last slide is, what do I think is required for innovation? Well, it does take perseverance. It isn't a short-term enterprise to try to fundamentally change the technologies that are available to treat kidney failure. The kidney is a complicated organ. It's going to take serious investment on both the public and the private side, and that's one of the bigger challenges, I think, that is still remaining. We need to unite science and advocacy, very much like George Schreiner did, for example. And for that matter, Belting Scribner did. And coalition, and Willem Kolff, I should say, too. We need coalitions, we need collaboration, but most importantly, we need patients as partners every step of the way in what we're doing. And with that, I will turn it over to Larry Kessler to take it from here.